Have you ever experienced that sharp, shooting pain when reaching overhead? Or woken up with stiff, aching shoulders that barely want to move? I've been there myself, spending countless hours hunched over a computer. And I know firsthand how shoulder pain can completely disrupt your daily life. Here's something truly remarkable that might surprise you. According to research from Johns Hopkins Medical Center, 80% of shoulder pain is actually preventable. Their study of over 2,000 participants found that people who consistently performed simple prevention exercises had a 73% lower rate of shoulder-related injuries compared to those who didn't. Today I'm sharing the exact shoulder pain prevention exercises that orthopedic surgeons and physical therapists recommend to their patients. These aren't just pain relief methods. They're scientifically proven techniques that keep your shoulder joints healthy and pain-free from the start. Some of what I'll share today might challenge what you think you know about shoulder care. By the end of this video, you'll understand why many people have been doing shoulder exercises completely wrong, and, more importantly, how to do them right. Understanding your shoulder anatomy is crucial for effective prevention. Your shoulder is the most complex and mobile joint in your body, formed by 3 bones: the shoulder blade, collarbone, and upper arm bone. 17 different muscles connect to this area, working together to create the incredible range of motion your shoulder possesses. The most critical component is your rotator cuff, consisting of 4 small but mighty muscles: the supraspinatus, infraspinatus, teres minor, and subscapularis. These muscles stabilize your shoulder joint and enable smooth movement. Research from Harvard Medical School shows that rotator cuff imbalances are the primary cause of shoulder dysfunction in adults. Modern lifestyle creates perfect conditions for shoulder problems. When you're looking at your phone, typing on a computer, or driving, your shoulders roll forward and your head juts out. This posture shortens your chest muscles while weakening your back muscles, creating a dangerous imbalance. A study from Mayo Clinic involving 500 office workers found that 92% of people who used computers more than 6 hours daily showed signs of shoulder joint imbalance. Left untreated, these imbalances can progress to serious conditions like frozen shoulder or rotator cuff tears. The first exercise is the doorway chest stretch, incredibly effective for releasing tight chest muscles. Stand arm's length from a doorway, place both hands on the frame, and slowly lean forward until you feel a gentle stretch across your chest. The key is slightly bending your elbows to reduce shoulder stress. Hold for 20 seconds and repeat 3 times. UCLA's sports medicine research found that participants who performed this stretch consistently for 4 weeks improved chest muscle flexibility by 35%. Sarah, a 42-year-old accountant I know, eliminated her afternoon shoulder stiffness after just 1 month of daily doorway stretches. The second exercise is shoulder blade squeezes, excellent for strengthening weakened back muscles. Sitting or standing, let your arms hang naturally at your sides. Then pull your shoulder blades together toward your spine. Think about pinching a pencil between your shoulder blades. Keep your chest open and chin slightly tucked. Hold for 5 seconds, then slowly release. Repeat 10 times for 3 sets. Stanford Medical Center research showed that 6 weeks of consistent blade squeezes increased back muscle strength by 42% in study participants. The beauty of this exercise is its versatility. You can do it anywhere, anytime, even during meetings or while commuting. One tech company reported a 60% decrease in shoulder-related sick days after implementing workplace blade squeezes. The third exercise focuses on external rotation, crucial for rotator cuff strengthening. Hold a towel or resistance band with both hands. Keep your elbows bent at 90 degrees and pressed against your sides. Slowly rotate your hands outward, stretching the towel while keeping your elbows fixed against your body. The key is isolating your rotator cuff muscles without using your shoulders. Start with light resistance and gradually increase. Perform 10 repetitions for 3 sets. Cleveland Clinic's study of tennis Players found that regular external rotation exercises reduced shoulder injuries by 78%. The fourth exercise is wall slides, designed to improve overall shoulder mobility. Stand with your back against a wall, press your arms flat against the surface. Then slowly slide them up and down like you're making a snow angel. Keep your arms in contact with the wall throughout the movement. Move very slowly and only within your comfortable range. Perform 10 repetitions. Massachusetts General Hospital research, involving 50 patients with limited shoulder mobility, found that 8 weeks of wall slides improved range of motion by an average of 28 degrees. This exercise is particularly effective for early-stage frozen shoulder. Lisa, a 52-year-old teacher who couldn't even brush her hair, regained normal function within 6 weeks of consistent wall slides. The fifth exercise is pendulum swings. Place one hand on a table or chair for support. Lean forward, and let your affected arm hang naturally. Gently swing your arm in clockwise and counterclockwise circles, using gravity rather than muscle force. The crucial point is keeping your shoulder muscles relaxed and letting gravity do the work. Forcing movement can cause more harm than good. Perform 10 circles in each direction, 2 to 3 times daily. Georgetown University Medical Center applied this exercise to post-surgical rehabilitation patients and found recovery time improved by 25%. This exercise works for general prevention as well as post-injury recovery. The sixth exercise targets your neck and shoulders, an often overlooked connection. Gently pull your head to one side with your hand, while dropping the opposite shoulder down. You should feel a stretch along your neck and upper shoulder area. Hold for 15 seconds and alternate sides for 3 sets each. Johns Hopkins neurology research found that people who consistently stretched their necks had 45% fewer shoulder pain episodes. Now let's discuss effective implementation. Don't try all exercises simultaneously. Start with doorway stretches and shoulder blade squeezes in week 1. Spend just 5 minutes each morning establishing this foundation. Add external rotation in week 2, wall slides in week 3. Then pendulum swings and neck stretches in week 4. This gradual progression prevents overwhelming your routine, while building sustainable habits. Consistency trumps intensity. 10 minutes daily beats an hour once weekly. Research from Boston Medical Center showed that daily 10-minute exercise sessions produced 20% better pain reduction than 3 weekly 30-minute sessions. Important safety guidelines exist. First, never exercise through sharp pain. Mild stretching sensations are normal, but stabbing pain requires immediate cessation and professional consultation. Second, always warm up with gentle shoulder rolls or arm circles before exercising. Third, maintain natural breathing throughout exercises. Holding your breath increases muscle tension and stress. Fourth, exercise both shoulders equally, even if only one side hurts. Favoring one side worsens imbalances. Lifestyle modifications complement these exercises. Position computer monitors at eye level, adjust keyboards so elbows remain at 90 degrees, and raise your phone to eye level instead of craning your neck down. Sleep positioning matters too. High pillows or stomach sleeping stress your shoulders. When side sleeping, keep the painful side up, and adjust pillow height so your shoulder and neck align. Real success stories demonstrate these principles work. Michael, a 38-year-old software developer, suffered chronic shoulder pain for 3 years. After consistently implementing these exercises, he became completely pain-free within 6 months and now runs marathons. Another case involves Patricia, a 60-year-old, who was recommended surgery for frozen shoulder. She chose exercise therapy first, and after 3 months regained full range of motion without surgical intervention. Most people notice changes within 2 to 3 weeks and experience significant improvement in 2 to 3 months. Individual results vary, but consistency produces reliable outcomes. Know when to seek professional help. If pain persists despite consistent exercise, prevents sleep, or causes arm weakness or numbness, Consult an orthopedic specialist immediately. Sudden severe pain or post-injury pain also requires prompt medical attention. Early diagnosis and treatment prevent chronic problems. Don't wait until simple issues become complex surgical cases. Remember, these doctor-recommended exercises are medically validated, safe, and effective methods. However, consistency remains the most critical factor. Invest just 10 minutes daily, starting today, to build healthy, pain-free shoulders. Imagine enjoying complete freedom of movement without shoulder pain. Limiting your activities. These exercises can make that reality achievable. If this video helped you, please like and subscribe, and share with anyone struggling with shoulder discomfort. I'll return with more valuable health information in the next video. Stay healthy and pain-free.